Today, more than ever, household pets are suffering a traumatic injury, are being treated, rehabilitated, and returned to their families thanks to advances in veterinary medicine.
Our own Jon Hansen is out live at Veterinary Specialty Center taking a look at their Level 1 Veterinary Trauma Center.
Yeah, good morning, guys. You say Level 1 Trauma Center, and I walked in here, and the first thing I thought of is it looks like an ER for humans that you have here, and it's wonderful. It's for pets, and we're here with Dr. Jennifer Herring this morning. How you doing?
I'm fine. How are you?
I got to say, you have the last name Herring, and I trust a vet who has the last name of an animal, even though it's a fish, but I trust that.
Oh, I love that.
You can use that now from now on.
There you go.
So when we say Level 1 Trauma Center, what does that mean?
Basically, what we're talking about is a network of hospitals that essentially has the goals of advancing trauma medicine and helping to disseminate information so that researchers can take what we know from our cases that we see every day and help us gather information about what's going to help these patients in the future. And then it's also kind of bringing a team of hospitals together to collaborate on what's best for trauma medicine.
And there aren't many of them. There's some on the East Coast, but we're the only one in this area.
We're the only one in this area, the only one in the Midwest, actually the only one from the East Coast on into the Midwest and West side. So there's only 6 Level 1 trauma centers, and we are one of those 6.
You mentioned trauma, and these are obviously difficult discussions to have about what happens when something happens to your pet. But I guess it's really important to know that this is a place that people can go in 365. You guys are here 24/7.
24/7, 365. We're always open. There is always a critical care emergency specialist on 7 days a week here. There's emergency doctors 24/7 here. There's during the daytime a myriad of specialists that will be walking in the building shortly, and they basically will cover everything from cardiology to neurology to surgery to medicine to radiology and kind of on.
We're showing Milo over there. Milo looks a little tired. That's how I look in the morning, Milo. Don't worry. I hear you. I hear you. All right, so all morning long, we're going to be finding out all the great things that you guys do, because really, I mean, these pets are part of our families.
They are, and that's what we really want to bring back. I mean, we're basically kind of taking those impossible cases, or what used to be the impossible cases, and giving them new hope.
All right, okay. So we're hope. That's the key word here for today. We're going to be meeting some really cute pets all morning long. Danielle, back to you in the studio.